Secretary Julie Willems Van Dyke.
Well, good afternoon, and thank you for joining us today. As of today, we have administered 248,185 doses of COVID-19 vaccine here in Wisconsin. This includes 40,545 second doses, so 40,545 of our healthcare workers or nursing home staff and residents have completed their vaccine series. Last week, we announced our mobile vaccination team's pilot program and the expanded vaccine eligibility to fire and police first responders. This week, that work begins. Mobile teams are in place and vaccinations of police and fire personnel are starting. Today, we are announcing another expansion in eligibility. Starting Monday, January 25th, Wisconsinites age 65 and older will be eligible to receive the COVID-19 vaccine. This is a significant expansion. There are approximately 700,000 Wisconsinites over the age of 65. Let's remember, our state currently only receives 70,000 first doses of vaccine per week. So it will take some time to reach everyone in this age group who wants to be vaccinated. COVID-19 vaccination is the most significant public health undertaking of our lifetimes, and we have built the system to make it possible. But we can't vaccinate everyone at once, and we can't vaccinate everyone without more vaccine. So those of us working on the state response will continue to push for more vaccine and to further improve our systems as we receive more vaccine. And while we do that work, we ask for your patience. Our healthcare providers, our local and tribal health departments, and our pharmacies are doing incredible work already, vaccinating our healthcare workers and staff and residents in long-term care facilities. And as they expand this vaccination to Wisconsin residents over the age of 65, we need to remember their dedication and be patient as the effort gets up and running again. Again, this will take some time. Again, 700,000 people, 70,000 doses a week. With more Wisconsinites eligible to receive vaccine, we want to make sure you are able to get accurate information. So we have updated the DHS website to make information easier to find. These updates include up-to-date information on who is currently eligible and next steps to take to get vaccinated, as well as other frequently asked questions and our current vaccine data. We've refined that data reporting as well. If you visit the vaccine data page, you'll notice that our doses shipped number has now been broken into doses ordered and doses in transit. It is our hope that this will better illustrate the vaccine distribution and allocation process by clarifying that vaccine providers in Wisconsin have ordered 473,300 doses and that 100,100 doses are in transit this week, meaning they were ordered by providers last week and are expected to arrive at vaccinating locations throughout this week. As part of our commitment to transparency throughout the pandemic, we are also launching new visualizations using demographic data for COVID-19 vaccinations by age and by gender. As we continue to strengthen our vaccine rollout here in Wisconsin, we also need to remember that COVID-19 is still incredibly high and spreading here in Wisconsin. We are adding 1,525 new cases today, which brings our total number of confirmed cases of COVID-19 to 524,402 people. Our 7-day average of new cases is 1,895 new cases over that period of time. Today, we are reporting 42 more Wisconsinites who have died from COVID-19, which brings our total deaths to 5,512 people. Our thoughts are with the families and friends of those who have lost their loved ones. We must each do everything we can to continue to stop the spread. Stay home and limit your interactions to the people you live with. Wear a mask and physically distance when you go out for the essentials, and wash your hands frequently. These are still the best steps we can take to keep ourselves and our families safe in the face of COVID-19. Before we take your questions, I want to take a moment to thank Secretary-Designee Andrea Palm for her services to our state. Yesterday, President-elect Biden nominated Andrea to be the Deputy Secretary of the U.S. Department of Health and Human Services. And let me just say that as someone who has worked in close partnership with her over the course of this pandemic, I am thankful that someone as dedicated, intelligent, kind, and tenacious as Andrea is going to fill that role at the federal level. Wisconsin is better off thanks to her leadership, and so is the country. So thank you, Secretary-Designee Palm, for your service. And now I'll turn it back to Elizabeth so we can take your questions.
Well said. Thank you, Deputy Secretary. Let's go now to our reporters on the line. A reminder to maintain your audio quality, remain muted until it's time to ask your question. If you're on the phone, you're able to do so. Use *6 to mute and unmute. And we begin with Scott Bauer at the Associated Press.
Hi, thanks for doing this call as always. Julie, can you just talk me through, let's say you're 65 years old, you see this story today. What should that person do? Should they contact their doctor? Should they contact their pharmacy? Is there a place where they need to register? Just what does a 65-year-old do today?
Yeah, a 65-year-old has a couple of places they go. And the first thing I do is say, as much as possible, use the web. Because if every one of those 700,000 people calls their doctor's offices today, will crash phone systems all across the state. And we know that's happened in other states. So I want people to think about, like, where would you go get your flu shot? And then go to the website of that place. If you go to your doctor's office, usually to get your flu shot, go check their website. They probably have instructions about how they're doing appointments for people age 65 and older. If you usually go to your pharmacy, check their website. If you usually go to a clinic held by your local health department, check their website. You can check all of these different avenues for who may have availability. We know a number of health systems are reaching out to their patients over age 65 and saying, you know, we've got a system in place. We've only got so much vaccine. We're going to reach out to people and say, you know, it's available for you. Would you like to make your appointment now? And titrate this over the next few weeks. But it is going to take some time, and it is not because the people aren't there to vaccinate. It's because there isn't going to be vaccine in everybody's hands right away to be able to conduct these vaccines. So I implore people for their patience, encourage them to use websites and their MyChart system for scheduling, and be a little patient. We just announced this today. We did give our healthcare providers a little bit of headway on this, but it's going to take a week or two to really get rolling on this, for everybody to have all their communications up and be communicating with their patients. But that will come, and we will get, you know, people will get their vaccines. It just may be not tomorrow, but sometime in the next month or two.
All right, thank you for that. Let's go now to Ben Krumholtz, WLUK in Green Bay. Ben.
Hi, thank you for the opportunity. Can you explain why the state isn't going with the CDC recommendation and including grocery store workers with the phase 1B vaccination?
So first of all, the state has not made a decision about phase 1B. That decision is still before our State Disaster Medical Advisory Committee, and they are reviewing public comment that has been made and will be making final recommendations to us over later this week. I do want to say once again why we are doing people over age 65 before we do anyone else. And that is because if you look at our death data around who has perished from this disease, it is disproportionately people in older age groups. And so this decision to put people age 65 and older first is one based in the realities of this disease. This is the population that has died at the highest rates, and therefore the population we want to protect first. It is also in alignment with what the federal government recommended last week to put people age 65 at the front of the line, and that is why we are proceeding with this decision today.
Thank you. Now to Nick Bohr, WISN Milwaukee. Nick.
Good afternoon, and thanks for taking the call. I just wondered if this was something that was done on the fly based on what you were seeing in the first few weeks of vaccinating, that maybe those groups were taking longer than you might have thought to get to, or that the vaccine wasn't getting to as many people as you wanted. Is that why the decision was made to open it up to a broader population? I mean, 65 and plus obviously is a very broad population.
So throughout the process here, we have been evaluating the amount of vaccine and the potential recipients of vaccine. As I've mentioned earlier, we're also thinking of this in a way that as you look at one phase of providing vaccine to a group of people, you think about when you're a part way through that phase, that you open up the next phase. An analogy I've used to describe that a number of times is think about boarding an airplane. You know, they call for zone A and a whole bunch of people get on the airplane, and when the line starts to come to a trickle, then you call zone B. And that's where we're at right now. We've been doing healthcare workers and people in long-term care for a little over a month now. Just a little over a month. Let's remember, we just started vaccinating on December 14th. And as you look at the numbers, we're about halfway through what we think that population would be. And so that's the point in time where you would think about, let's open zone B now. And the reason, as I said earlier, we have chosen this population to be at the front of the line with zone B is because of the dire consequences they have suffered as a result of this pandemic. We are trying, it's a win-win. We have people who really need the vaccine. We do have vaccine out there. It is an easy population to identify. It only requires one to know your age in order to move it forward. And so, yes, it is part of getting life-saving vaccine and arms as quickly as possible. And let me just once again reiterate that it is 700,000 people with a weekly supply of about 70,000 vaccines. So it is still going to take us a long time to get this group vaccinated unless we start seeing more vaccine from the federal government. I was told this morning by General Perna that we're likely to see a stable supply of vaccine for the next 3 to 4 weeks. We'll see if that is how it unfolds, but at this point in time, we don't have anything to indicate to us that we're going to have a huge new supply of vaccine anytime soon.
Thank you for that. Now we go to Madeline Anderson at Fox 6 in Milwaukee. Madeline.
Hi, my question is just can you break down the different ways that this vaccine will be available to people in this 65 and older age group? You mentioned, you know, people can contact their doctor's offices, they can go to a pharmacy. So are you saying that Walgreens and CVS and the local pharmacies will start to be administering the vaccine to this category? And then what about some of the local health departments or community clinics as well? Thank you.
Dr. Schauer, would you like to take that question?
Sure. I think, as we start, we certainly anticipate that healthcare will be an important partner, but also pharmacies. And as we move forward in the campaign and vaccine becomes more available, it will become more like influenza, where vaccine does go into places like pharmacies. We currently are working with the CVS and Walgreens pharmacies to go ahead and vaccinate individuals in the skilled nursing facilities, as well as the assisted living. And so those two are really focused on moving through those particular populations. I'm happy to report that we anticipate the skilled nursing facilities will likely finish up this week. They have over about 89% of those facilities completed with their first dose, and they will make that transition into working with the assisted living. The assisted living is about 4,500 entities, and so they will be focusing on that and continuing. And many of those individuals in that age group are also in these facilities, so it's almost doing double duty.
All right, thank you for that. Now to Rob Sussman, WTAQ Green Bay. Rob Sussman.
Yes, thanks for taking my question. Have you heard anything from anybody regarding how long it might take to start seeing returns in the infection data from vaccination? What I mean is about how long until we can reasonably see a drop in infections, in deaths as a result of COVID-19 vaccination? Thank you.
Dr. Schauer?
Yeah, that's a really good question. I think it's really hard to say. It's important to remember that vaccination is another tool in our fight against the COVID-19 vaccine disease, and so that people will continue to need to practice the social distancing, the hand washing, etc. The number of people, while we're making great gains in terms of number of folks vaccinated, the percentage of the population is still relatively small, and so we have to continue with many of these efforts until we have a significant portion of the population covered and getting to that community immunity. That number has not yet been clearly defined. I think many experts are saying somewhere 70% or higher is needed in terms of having people protected, but we've got a ways to go. And as Deputy Secretary said, it is going to take us some time to continue to move through the eligible population. So it's going to be a while.
And I would just add one more thing. As Dr. Westergaard said last week, we all need to remember that even though we have encouraging news that rates of disease appear to be declining, we are still at very, very high rates of disease in this state. And so COVID is very present, and it's still a forest fire burning. We're starting to see some control of it around the edges, but it's still a big old forest fire burning. And so I don't think we should be lulled into a sense of complacency that just because we're seeing declines that we have this thing nailed. We are still at a very high rate, and we need to continue our preventive measures.
Thank you. The next question to Stephanie Hoff at WIS Politics. Stephanie.
All right. Hello, thanks for taking my call today. So I'm wondering why Wisconsin has received significantly fewer doses per its population than others. So I understand all the states are allocated COVID-19 based on their population. So I would assume all of those rates to be similar, but the CDC shows that the amounts shipped per population vary greatly between the states. So again, just wondering why Wisconsin has received significantly fewer than other states. Thank you.
I'm not aware that Wisconsin has received significantly lower doses per population than the rest of the states. Sometimes when you do those comparisons, just eyeballing it, It is distorted by the pharmacy program that we've described. When that pharmacy program was initiated by the states, and as we've described earlier, we initiated Part B of the pharmacy program later than other states because we had to save up more vaccine in order to initiate it. So to the best of my knowledge, Wisconsin's allocation of vaccine has been at a rate similar to other states. Dr. Schauer, do you have anything further to add on that?
No, I would agree. I think it's sometimes difficult to compare state by state because of these vagaries, particularly with that pharmacy program.
Thank you. Let's go now to Danny Maxwell at WKOW in Madison. Danny Maxwell.
Hello, this is AJ Byatt-Port filling again for Danny again. Thank you for having this call. My question is, how is DHS going to be working with its vaccinator partners to divide which portion of a weekly allocation goes toward remaining populations in phase 1A, and then whatever's left over, dividing that into the subpopulations of 1B, like fire and police versus residents 65 and older? And following those decisions, at the end of the day, if I'm, a 67-year-old person living in the state, when can I reasonably expect to be able to schedule an appointment and have a day I can put on the calendar to get vaccinated?
Reasonably, for sure, within the next couple of months. If you do the math, 700,000 doses or people necessary. 700,000 people over age 65, 70,000 doses a week. Reasonably, we anticipate we'll be able to do this within the next 2 months. If vaccine supply increases, awesome, then we'll be able to do it a lot quicker. And we do know there are a couple of vaccines in phase 3 trials that may very well come to the point of an emergency use authorization within that period of time, which would create more vaccine supply and accelerate this. In terms of your question about how vaccinators will make this decision, I think we're not going to be subdividing a vaccinator's request for vaccine into how much for phase 1A and how much for people 65 and older. Vaccinators will make requests to us. We will evaluate all of those requests using the criteria and formula that our State Disaster Medical Advisory Committee has provided to us. That includes the philosophy that everyone who applies for vaccine will get some. And if there are more requests than more requests than vaccines available, that will proportionately shrink each applicant's request, and that we also apply the social vulnerability index to how we distribute those. So communities that have people who are experiencing conditions that would put them at greater risk for COVID-19, those communities receive a slightly higher allocation of vaccine from which we distribute. So that's how vaccine will be allocated as we anticipate this week. We will have more requests for vaccine than it is available. And then each provider will take that and reach out to the eligible populations that are certainly currently okayed for vaccine and schedule their patients accordingly.
Thank you. The next question to David Wahlberg at the Wisconsin State Journal.
Yes, thank you. Given that supply of vaccine is still relatively low, and ACIP initially recommended 75 and older, and SDMAC was initially discussing 70 and older, what led to the decision to go with 65 and older now, given that that is such a huge group that will certainly create a lot more demand than can be met initially?
Well, the huge group is 70 and older. You add about another 100,000 by adding the 65 to 69-year-olds. So our decision to go with that whole group was largely to align with the federal government and what they had recommended last week, that we know many other states are implementing, and requests from our vaccinators to open up the opportunity for them to vaccinate more and be able to move vaccine even quicker. Dr. Schauer, would you add anything further to that?
No, I think that's it. Thank you.
All right, thank you both. Now to Shemaine Mills at Wisconsin Public Radio.
Hi, thanks for the call. I'm wondering, will Wisconsin do what Florida has done and say anyone over 65 can get a shot, or will shots in Wisconsin be restricted to those who are residents only?
We are focusing our vaccines on people who are patients and of our healthcare providers. Some local health departments may make the choice to restrict vaccination to residents of their local community. Pharmacies will likely vaccinate any customer who comes to their pharmacy. We have not made a decision at this point in time that says we'll only vaccinate Wisconsinites. If we start to see some huge migration from other parts of the country, we may need to revisit that. I can tell you that right now, our healthcare providers who are vaccinating their staff have certainly vaccinated people who live across the border, because we want to get key populations vaccinated in the state. So if there is a healthcare worker who lives across the border in Illinois or Minnesota taking care of Wisconsin patients, we want to be sure that they are properly vaccinated. So we haven't made decisions about excluding people outside of Wisconsin. This vaccine is a federal asset. It is an asset available to people across our country. And if we ran into some issue that would create some kind of surge, we would, as we do with everything in COVID, reevaluate and consider any other policy decisions we would need to make.
Thank you. Next question to Brittany Schmidt, WBAY in Green Bay.
Hi, yes, I just had a question. So we talk about, this is a huge announcement. This is technically the first phase of general population to get the COVID-19 vaccine. And I know you kind of talked a little bit about how people shouldn't call because the phones will be inundated. I know that I've talked to a few local places already, the health departments, who say, yes, we're getting so many phone calls. We're really not sure where to send people. So I know you talked about signing up online and stuff, but is there a phone number that people can call besides their healthcare providers and stuff to not bog them down? But also, what about the rural communities or those that really are not tech savvy at all or even don't have internet access? What should those 65 and older do?
Yep. Clearly I am not saying you can't call. And so if you do not have access to the internet, for whatever reason, and you have access to a telephone, certainly call your healthcare provider or your local health department and talk with them. I think the other thing people can do is this week, we also set up a weekly newsletter about vaccination. And you can sign up for that on the DHS website. Go to the vaccination portion of that and sign up, and you'll get weekly updates that will also help people understand how the flow is going and what other options are available for them. Again, this is a process that will happen over the next couple of months. We have done many changes to our website that also now demonstrate who is eligible for vaccine, helps guide them on who to call, and we will keep that updated with further information. So this is an important step forward. This is a process that will take a number of weeks. And so honestly, if I was 65 today, I think I'd say, that's good. I know I'm going to get my vaccine before summer comes, and I would simply wait a few weeks and see as more information comes out and then look for a place. But I know there are others who are really anxious to get this vaccine and want to make every call they can to find the first place they can. And again, you know, we have a system of many different avenues to do that. And that is how we will effectively deliver the vaccine, the COVID vaccine, very similar to how we deliver flu vaccine through those many different avenues.
Thank you. The next question to Eric Gunn, Wisconsin Examiner.
Thank you for taking the question and for doing this call. What volume of vaccine production, or alternatively, how much vaccine shipment in a week would be necessary for the state to be able to say, okay, we can lift these prioritizing guidelines and everyone is eligible for the vaccine at this point? What kind of volume of shipments would be necessary for that to be possible?
Well, Eric, it depends on what kind of timeline we're aiming for in order to achieve 80% immunity. And it also depends on how many people we get done in these earlier phases. And it depends on how many vaccinators we have. You know, we're really thrilled. We have over 1,200 vaccinators, so we've made really good progress there. We're in the process of working with a number of partners across the state to increase access to vaccine as we anticipate supply will increase over the, hopefully, sometime in February or March. And so we're working on having a number of community-based clinics available to people as that supply hopefully increases. So there'll be places, community-based clinics hosted by local health departments. We're working with the university system and the plans that President Thompson has talked about to increase access on university campuses. We're working with our pharmacy partners, again, to increase access through local pharmacies. We know employers are interested in bringing vaccine clinics into employment settings. So we're getting ready for, we're doing the planning for when the supply will increase so that we have many more avenues for people to get vaccine. So if we were to strive to have 80% of the population vaccinated by the end of June, or say this is a 6-month period, we need 3 times the amount of vaccine we have now. And for sure, if we had that, I think we'd feel very comfortable opening things up widely. And especially if, you know, over the next month or 2, we've been able to vaccinate, you know, 1 million people between our phase 1 and our older adults and others who may come in through phase 1B. So it's hard to tell you an exact number and an exact date, but I would say, you know, at this it's balancing how many are eligible with how many doses you have. And we'd be needing to look at least 2 to 3 times the volume we have now to widely open the gates and just say anybody.
Thank you for that. Now to Anita Weir, Northside News in Madison.
Hello. All right.
Hi.
I'm still unclear. How do you determine which providers get how much of the weekly supply?
So this is how the process works. We have 1,200 vaccinators across the state, and each week a survey goes out to them, all of the eligible vaccinators, and we ask them, how many vaccine doses can you give in the next week for the eligible populations? They turn that information in, and we use an allocation formula to determine how much each of those vaccinators will receive. Up until this point in time, we've been able to give most vaccinators 100% of what they've asked for. Over the last couple of weeks, we've had to cut some back, particularly those that were only requesting Moderna vaccine, because we don't have that much available Moderna vaccine due to the volume of that vaccine going to the pharmacy program. When we have a situation with far more vaccine dosages requested, then we have available. There is a formula that both looks at the social vulnerability index that distributes the vaccine across geographic populations of the state proportionately. And then within that geographic distribution, we look at each clinic or pharmacy or health department that has asked for vaccine, and we would cut, if we didn't have enough, we would cut them proportionately across the state after that social vulnerability index was factored in.
All right, thank you for that. Now, next question to Sean Kirkby, Wisconsin Health News. Sean Kirkby.
Hi, thanks for this. I was wondering, to what extent are you planning to follow the SDMAC recommendations that are going to perhaps come out this week? I mean, when you've moved into the different priority groups already for phase 1B as older than 70 and sort of older than 5 and police and fire, just to what extent, I mean, what kind of recommendations are you expecting to see from the committee that you're planning to implement beyond those groups?
Yeah, you know, the committee received nearly 5,000 comments from the public about those recommendations. So it's hard to say, Sean, what the final product is going to be from the SDMAC. And I think the challenge we face and that committee has faced is that every group that they have looked at in the Advisory Committee on Immunization Practice, the federal government has looked at, have valid reasons why they are on the list to receive vaccine before the general public does. And as we've described, we don't have enough vaccine to meet the needs of all of those people. And so we will look at that list very carefully, and we will look at the analysis by the group, and we will make a determination about whether we accept their recommendations in full or whether we feel there's any need to adapt them in any way. And then that's one decision to be made, is who would be part of the next group to receive vaccine. And then, just as we've done here, we'll need to think carefully about at what point in time we add additional groups into this pool of people eligible for vaccine. This is part of the reason we have started a couple of the groups in 1B a little bit sooner. Again, as I said in answer to Eric's question, the more people we can get through now with vaccine that we do have available, even though it's not in sufficient supply for everybody, that means there's fewer for the future. So we're maximizing the use of the vaccine now with groups and trying to get a little bit ahead of the curve, and that will create more space for those other groups at the point in time down the road. And again, as we hope to see more vaccine flowing in the next month or so.
Thank you. Next question to Tom Lally, WAOW in Wausau.
Hi, thank you so much for taking my question. With those 65 and older making up a greater percentage of the population in northern and rural Wisconsin counties, will vaccinators in those areas receive more doses in the coming weeks?
Dr. Schauer, you want to talk a little bit more about allocation in our rural areas of the state?
Yeah, sure. So, as the Deputy Secretary said, there is a formula that is used that does take into consideration geographically where they are, and that's the Social Vulnerability Index. So it will go ahead and take that into account when it is being run. I think it's also important to remember that some of the logistics around the vaccine, also in terms of the amount of vaccine that they can store and that they can use within those 5 days, particularly if they're receiving the Pfizer vaccine, also factors into it. We do anticipate that we will have more Moderna available as we move forward, as we make our away with the pharmacy program and finish up the skilled nursing and continue into the long-term care. And so that will give us additional flexibility. But the hub and spoke model that we have been using for the Pfizer vaccine really does allow getting the number of doses that are needed, even for those smaller clinics that we knew the challenge initially was the 975 doses in the storage. And using that hub and spoke model really has allowed us to get smaller numbers of doses out to a clinic regardless of where they're located.
Thank you. Now we go to Brittany Lewis, CBS 58 in Milwaukee. Brittany. A reminder. Oh, there you go. Go ahead.
When might there be some sort of online registration or database where people can go to see if a pharmacy or if a clinic in their area actually has the vaccine, so they're not having to call around or search online at various times?
We are in the process of, as I said, as we set up community-based clinics, we'll have a central place where people can register, find out if they're eligible. If they're eligible, get a list of community-based settings where they could make an appointment to go get vaccine. And again, as our community-based strategy opens up next month, again, if we have enough vaccine, we will have that kind of tool available. We're also working, just as we did with our community-based testing, setting up a place on our website where we can show community-based sites where anybody can go to get a vaccine. There'll be a map and an opportunity for people to search that way. These are all planned in place for when we open this up more broadly and there is more vaccine available across the community. So right now we are using the healthcare system that we have in place. We don't have a centralized healthcare system in the US. We don't have a centralized public health system here. Each local health department is run by their local jurisdiction, county or city. And so I think, you know, people know their community the best. They know their healthcare providers, they know their pharmacies, they know their local health department. And so this is a very localized system, and we are confident that with patience, people will be able to navigate to an appropriate provider for this first phase of the vaccine while it is limited, and get access over time to a vaccine.
Thank you. Now we go to Austin Montgomery, Beloit Daily News.
Hi, thanks for taking the call. Does the state have any sort of outreach plan for people who might not have an established healthcare provider or might not be that tech savvy? Would you recommend, how would you recommend residents who are 65 and older find those resources about the vaccine?
Yeah, I think another avenue we'll certainly be working with is there are a number of resources that are provided to people who are 65 and older. And so there's many ways to reach out to that population. We'll be reaching out to the Association of Retired Persons, reaching out to our Aging and Disability Resource Centers, to senior centers, to let people know they are now available and let them know what the different avenues are for how they can access vaccines. So we'll work very closely with key stakeholders who work with people who are over age 65, and those partners who work with different populations are really an important part of messaging and reaching out and supporting people in securing vaccine.
Thank you. The next question to McKenna Alexander, WQOW in Eau Claire. McKenna. McKenna Alexander. All right, let's move on to Gabby Bachara, News 3 in Madison. Gabby.
Hey there, it's Lane Kimball in for Gabby today. I know the answer is we just don't know yet, so I'm not asking when, but I suppose just is it realistic at some point when we do expand our access to vaccine that we see large-scale community vaccination clinics at places such as, you know, Pfizer Forum, Miller Park, the Cole Center in Madison, maybe even Camp Randall. I know you talked about working with UW system as well, but is that something that we could realistically see at some point, maybe in the late spring, early summer, of those large-scale mass clinics?
Yes, I mean, there's planning for a variety of different ways to provide community-based vaccination. And I think it's helpful to think back to how we developed access to community testing for COVID-19. If you remember way back in the beginning, it was very difficult to get a test unless you were very, very ill. Most tests were done in hospitals and not even in clinics. And so we're in a similar situation. That was because supply was low. As supply increased, it became much easier to get a test throughout the state. You could call your doctor and get a test. We never went to the pharmacy option with testing, but then we established a whole variety of community testing options, including some pretty large scale events like you're speaking of, you know, at the Alliant Energy Center here in Madison, at Miller Park in Milwaukee. And so it's a model that I think we will build on. It'll be interesting to see at the point in time that we open to the general public, how many people are left to get vaccine. And we are in discussions with a number of parties around larger sites. And so we'll see when the time comes, but I think the other balance of that is also making sure we have easily accessible sites all across the state. And so even a big network of smaller sites is also really effective in making sure that whether you live in Mercer or whether you live in Milwaukee or whether you live in Platteville, you have access to this vaccine as the volume of it available to us increases.
Thank you. The next question to Will Cushman at WisContext. Will Cushman.
Good afternoon, thank you. I want to make sure that I'm understanding the changes that you just made to the vaccine data page. So the new categories for, let's see, vaccines ordered and in transit, would those, the sum of those two categories equal what was previously labeled vaccines that were shipped? And then the second part of my question is, can we assume that so there's 473,300 doses that are labeled as ordered right now and another 100,000 that are labeled as in transit. Can we assume that the ordered number minus the in transit number, like that number of doses is in Wisconsin? Thank you.
I'm sorry, Will, I was trying to look at the site while you were speaking. So are the ordered numbers in Wisconsin?
Right, yeah, sorry, there's a lot of numbers. So previously there used to be a category labeled like doses shipped. Is ordered plus in transit, is that essentially the same thing? As what was previously labeled as shipped,
yes.
Like the sum of those
ordered plus
okay,
in
great.
transit is, we subdivided shipped into ordered and in transit. So the in transit are vaccines that we just ordered at the end of last week. And what happens is they're put into the federal system on Thursday. Then they send them to the manufacturers, well, to the different methods of shipping, and then they come into the state over the first part of the following week. So we were trying to help people see of the number of vaccines previously called shipped, how many of them are actually in the process of getting delivered to us, and how many are already in the state?
All right.
Does that help?
It does. Thank you.
Okay.
Oh, thank you both. All right, let's go to Steve Hansen at WIS Community. Steve Hansen.
Thank you. Thank you for taking my call. In view of some of the communications difficulties with the federal government recently, can you say anything about what the current strategy is for withholding a vaccine for a second dose, and if it's likely that those second doses will roll out later than the recommended time period? Thanks.
Great question, which a whole bunch of state health officers just asked General Perna on this call I referenced earlier. And what we were told by the leader of Operation Warp Speed this morning is that when we order a first dose vaccine, they have the second dose vaccine waiting to allocate to us 3 weeks later if it's a Pfizer vaccine, or 4 weeks later if it's a Moderna vaccine. General Perna was very clear there has been no change in the federal policy around how they are doing that. And so basically, when you order the first dose, it is paired with a second dose that will be sent to the state per this ordering process at the appropriate time 3 or 4 weeks later. So I know there was a lot of discussion last week about a stockpile or releasing the second doses sooner, but at this point in time, those second doses are still being held to assure that everyone who receives a first dose of vaccine will receive their second dose per the clinical guidance and the emergency use authorization.
Thank you. Now to Ben Jordan, TMJ4 in Milwaukee. Ben Jordan.
Hi there. Just back to the 65 plus age group, 700,000 people. Are there concerns that this setup could potentially lead to people who are eager to get the vaccine shopping around, calling their healthcare provider, calling all sorts of pharmacies in their area to see if they can get on the list right at the front end of this, rather than waiting around? And could that create problems with equitable distribution?
Yeah, I think there's all kinds of opportunities for messiness in this, right? And the alternative was to sit and wait. And I think we've heard explicitly from our public and from our scientists and from our federal government and from ourselves that we want these shots in arms and we want to keep moving it as quickly as we can. This is life-saving vaccine. And so we're willing to experience a little bit of messiness in the beginning, and as we get more people through the system and vaccinated, and we'll hit a cadence, and we will get everybody vaccinated who wants a vaccine, and we will reach out to everybody and make sure they know that vaccine is available to them. It's just, we can't do all 700,000 the first week. We can't do all 5.8 million people in the first month. And so we're going to live through a little bit of trial and error about people finding where to go and systems setting up the best way to get this big tranche of people into the vaccination system when we don't have enough vaccine. Because if we had lots of vaccine, everybody would set up clinics, and we'd have Pfizer Forum already for everybody 65 and older in Milwaukee. But we don't have enough vaccine to do that right now. And so we're going to have a system where we'll step as many people through as we can week by week, and we'll get there.
Thank you. Let's go now to Maddie Heim at the Appleton Post-Crescent. Maddie Heim.
Hi, thanks for having this call as always. I just wanted to go back to what was said earlier about, SDMAC not having their 1B population finalized quite yet. And I'm just wondering if you could say a little bit more about why you decided to go ahead with opening it up to the 65 plus before those recommendations had been finalized, instead of kind of just lumping that new group of eligible folks in with the next round of recommendations from them. Thanks.
So a couple of reasons we wanted to do that. Number one, we were beginning to see phase one come to, we haven't completed phase one, but we were hearing many providers across the state saying, we've largely completed phase one, we have room to do more vaccination. It would be really helpful if we had more groups we could vaccinate. So it was that balancing of supply and demand. We're hearing from our vaccinators, they have more capacity. We wanted to give them a population to vaccinate. Secondly, we know this is a key population in the phase 1B recommendations for SDMAC. I don't think there was any question that older adults were going to be included in phase 1B. And so this, and third, this is the population that has suffered the most from this disease, that has been disproportionately affected by death from this disease. And so therefore, certainly the next population after our frontline healthcare workers and people living in long-term care, that we want to make sure we get shots in arms as quickly as possible. Because every shot in an arm of someone over age 65 is going to save a life. And that is why we are moving with this level of urgency. There seems like there's capacity in the system. There is vaccine, even though it's not as high a volume as we would want. There is vaccine. We know providers have some vaccine on the shelves, and we want to get that vaccine into arms, and we want to be protecting this population ahead of others that, while certainly deserving a vaccine, may not have as high a mortality rate as people over age 65.
Thank you. Now to Daphne Chen at the Milwaukee Journal Sentinel. Daphne.
Hi, thank you for doing this. Today we talked to a couple of local health departments who said they weren't expecting this announcement today and not really prepared for the influx of calls they got, and really didn't have a lot of information to give people as far as how to get them signed up. So I was wondering if you have a response to why some health departments feel this way, and just sort of why make the announcement at all if there isn't a super concrete plan yet in place to get people signed up. Thanks.
So we reached out to the member organization of local public health departments, and again, we meet with our local public health departments on a regular basis and shared that information there. We can't always get information to every single person in a local health department, and so it's unfortunate that some didn't get that message. And the reason we went ahead before everything was tidied up is because people are dying from COVID-19. And we have vaccine, it is available. We want to get shots in arms of people who are at risk for this. And that is why we're moving ahead. We will have many people who will get shots in arms this week and next week from vaccinators who have vaccine on the shelves, and those who will order it and have it arrive next week and the week after and the week after. So there may be some places that weren't quite ready this week. Now they know. They'll get ready, they'll get vaccine, and they'll be giving these shots in a couple of weeks. But for those who have vaccine on hand right now, those vaccines are much better in a 70-year-old's arm than waiting for us to do planning over and over and over again until everything is neat and tidy.
Thank you for that. And apologies, folks, we are out of time. I see there are a handful of reporters we didn't get to. Please follow up with DHS Media. Until then, we want to thank Deputy Secretary Julie Willems-Van Dyke, Dr. Stephanie Schauer, all of you for participating. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.